Okay, so we're going to be going over two different thoracic glide movements. These are both going to be out of this half kneeling position. The first one is just the thoracic glide from this hip flexor stretch, meaning you'll be stretching the hip flexor on this side. The second one starts in the same position, and we're going to be adding some rotation, and it will work slightly differently, but these are both included in this video. Okay, so the hip flexor stretch, the original version, you're going to get in this half kneel. And now if your balance feels a little off, double check that you are not like really narrow with your base. You can still have left and right spacing, right? And you can always even go a little bit wider if you need to, because we're not going to actually do anything over this leg. So you can give yourself a wider base for your balance. Just double check that this front foot is facing forward. If as you move your leg out, it started to open, just bring it back forward, okay? So now from here, we want to get a bit of a stretch through the hip flexor. So the way we're going to do that is if I'm postured up, I should be able to push forward from this hip, meaning that butt cheek on that side, if I squeeze that forward, it should push this hip forward and you should get a nice stretch through this part of the hip. The way that would look from the side, okay, this is kind of my starting position where I'm just balanced. As I posture up and I bring this hip forward while staying upright, I should get a stretch here, okay? If your angle has shifted to where suddenly you're starting to feel pressure over here, make sure that you are still upright because you may still have a stretch, but it's going to start to work differently. So the angle I have over here, you know, this roughly 90-degree angle, that should remain. All I'm doing is bringing this hip forward as I'm upright, okay? So now, once we're in that position, the thoracic glide, it's the same version as before when you were seated. Your thoracic spine, think of it as the middle of your back, right? So it's going to be, you know, approximately from like here to here. It's going through as much flexion, or you're getting rounding, and extension or arching, and we're going to remain in this hip flexor stretch. So we're essentially changing what the hip is doing on the bottom side of that spine movement. Okay, so I'll show it from the front and the side. When I'm doing my flexion, remember you can think of it as if something was traveling at your sternum and you were trying to get away from it. So I'm going to push my mid back towards the wall behind me while keeping my hips in the same place. So this hip is still pushing forward. I still feel the stretch, and now I go into my flexion, okay? If you suddenly lost this stretch, bring the hip forward again. Once I can't go anymore, now imagine there's a string pulling your sternum towards the ceiling. On this one, I can also let the head go back as long as my balance allows, and we're going to do as much extension. Okay, then I can reset. I have flexion, back towards the wall, and I have extension, chest towards the ceiling. Okay, so from the side for a couple, I find my stretch, back towards the wall, hip doesn't change positions, and then I have extension, sternum towards the ceiling. Okay, that's going to be our thoracic glide from the hip flexor stretch. Now we will add our rotation. Okay, so I'm going to do the other side for this one just so we can see both. I start in the exact same position. Okay, make sure you feel some stretch. As of right now in the setup, you don't have to be pushing forward from the hip yet. You should just feel a mild stretch. The key here is when I rotate, I want to only rotate until my sternum or my spine is looking at this knee. So it's about a little less than 45 degrees. More is not better. It actually will not work if you over-rotate to where I'm looking, you know, over the middle of my thigh or my T-band. That's going to be too far. Okay, so now I'll still bring that hip forward so I feel the stretch over here. I still have about a 90-degree bend on this side, or you can think knee on top of the ankle. And I'm going to turn 45 degrees, so I'm basically staring at my kneecap with my neck and my chest. And now I go through my thoracic glide. Your range of motion will be smaller because you are rotated. That is normal. Don't try and create more motion where there isn't motion. Okay, so from here, it's the same principle as before. I bring my mid-back towards the wall behind me, into flexion, and then I go into extension. It should basically feel like one side is getting more work and more stretch than the other. That's because of that rotation. So when I'm rotating to my left and going through the motion, my right side of my back gets more flexion or more stretch, and it also will feel different when I go into my extension. And then it will even out as you make it to the other side. Okay? So, angle towards the knee, 45 degrees. The stretch, I go back towards the wall, rounded, and I go into extension. And that spine through the mid-back is moving into rounded and arched.